Hello everyone, this is a complicated cataract in a patient with prior history of anterior uveitis. We have stained the anterior capsule here and we are going to do synechiolysis from 3 to 9 clock hours using OVDs. One can choose to do synechiolysis followed by anterior capsule staining if the synechiae are extensive. For pupillary expansion, we are using iris hooks in 2 quadrants only. If you want a 360-degree pupillary expansion, you can also use Malugin ring. Now, we begin with our capsular axis. And as you can see, the 1/3 part of anterior capsule has remained unstained because of the synechiae. The trypan blue did not reach beyond. Hence, after synechiolysis, one should remove the OVDs completely and restain the anterior capsule. You should let the dye stay for at least 20 to 30 seconds before washing it out. Especially if you're a beginner surgeon, please do not be in a haste. Seeing that this unstained part was very small, I decided to go ahead with the rhexis. I'm guiding my rhexis with the help of small strokes onto the flap, which are parallel in the direction in which I want to move my rhexis. I'm using shearing force to continue my rhexis in a controlled and precise manner. And I'm able to finally complete it successfully. This is a standard triplanar 2.8mm incision made temporarily with eye full of viscoelastic. Here comes the hydrodissection in all 4 quadrants, followed by hydrodelineation. Now I'm rotating the nucleus to check the completion of hydrodissection. Moving on to phacoemulsification with stop and chop technique. I begin by sculpting the nucleus, making sure to sculpt a wide groove so that it accommodates the tip as well as the sleeve of the phaco probe. This being a harder cataract, the nucleus needs to be sculpted many times to get an adequate depth of the trench. Once the trench is deep enough, that is at least 90% of the depth of the nucleus, I hold my 2 instruments in deeper plane of the trench and break the nucleus by separating it in 2 opposite directions. Once I have these 2 heminuclei, I chop them further into smaller fragments by using horizontal chop, also known as phaco 2. These smaller fragments are then impaled at foot pedal 3, brought up by pressing on foot pedal 2, and then emulsified again at foot pedal 3. The rest of the cortical matter is then taken out with the help of a coaxial irrigation aspiration probe. We refill the bag with a cohesive agent like Helon in this case. We take out the iris hooks before putting in the lens. The monofocal lens is implanted and dialed into the bag. We see a small cortical matter which was left behind before, so we take that out and the remaining viscoelastic in the final stage. Also make sure to monitor these patients in post-op period for resolution of inflammation, which might take longer than the typical cases. And the case is completed. Thank you very much for watching.